Today's session is going to focus on curbside care during COVID. As
Most places in our area have gone to what we call curbside care, meaning, the client will arrive at the clinic, they'll call in, we'll have either a technician or assistant jump on the phone, kind of get a history, of what's going on, primary complaints. They'll go out, get the pet, bring them into the building because we're not allowing anybody other than staff in our building. With the exception of euthanasias, which is a whole nother topic. But for all of their appointments, no clients are in the building. So the support staff will bring the patient in. The doctor will look at them, call the pet owner, the pet parent with a plan, get that okayed and kind of execute it.
would you say that during this time that the medical aspect of what you do has been altered, changed, or more challenging? And in what ways?
I think our medicine isn't different, but how we present is different, right? I mean, instead of talking face to face with somebody in a room about what we think is going on, what we'd like to do, what the cost of that looks like, now we're over the phone. And sometimes, I mean, I feel it's it's different and easier for the clients that we already have relationships with, right? That we already know. But anybody new, they don't have a face. I mean, it's this voice over the phone saying, this is what I think is wrong, this is what I think we need to do, this is what it costs. And that would be scary. I mean, I try to put myself, because I have two kids, so I try to put myself in the position of, if I was at their doctor, if this was happening, it would be scary to just ship them in. So I get that. I mean, so I don't think our medicine is different. I think the piece that's different is that communication piece, which I'm sure can affect our medicine. If someone is feeling like, whoa, I don't know about this, so it could be that people are saying no to some of the medical recommendations just because of fear. It is, it's very different. I think everybody's getting better at that. It's definitely more steps in the process. And then also just that disconnect of people are outside, and so for the most part, I would say people have been very gracious and accepting. And a lot of times we're even hearing gratitude, like we're just so glad that you're here and you can see, our pet. So most of the reaction has been that. But as always, there's outliers. There are people that are irritated by it. They want to come in. They're being told that this is the protocol, but they show up banging on the door, saying that they don't understand why no one's, letting them in or answering their call when they're calling. And, we're just all kind of doing the best we can. And we have had a couple of clients actually become abusive, calling staff members, expletives and that sort of thing. And it's one of those things where that wears on you, this job wears on you, period. And so I just kind of wanted to talk with Erin about how we can maybe diffuse, some of those situations where people are getting upset. And I also feel things as time goes on, instead of attitudes about this getting better, it's almost as if they're getting worse, because I think everybody's fatigued with the situation. And so there's just a level of frustration that that is high, and we're just all at extreme risk of burnout at this point. And before I let Erin kind of tackle some of these things, I think it's very simple things. Like one thing that I have noticed when I, I'm on the phone with people, because you always want to acknowledge, the weirdness of it, right? I mean, it's strange, and takes some getting used to. And so I'll usually say something like, thank you so much for your patience with, how we're having to operate during these times. Trust me, we think it's weird too, but it's for our safety and your safety, and people take that really well. And I've heard colleagues say, which we're basically saying the same thing, but I think that's where, as we all know, words matter. And sometimes using certain words just gives a different tone, right? You might not see a different response in somebody, but someone who's maybe right there on the edge, if you give them a different word in that explanation, sometimes that's the only spark you need. And so how I've heard maybe some other people say it are, thanks for putting up with this. And it's just that the difference between thank you for your patience, this is for you, versus thanks for putting up with this. Putting up with this already sets the tone. You should be irritated by this. Thanks for not being mad. So I just wanted Erin to maybe think of some ways, some language that we could as staff use. And then, as we kind of converse through this, maybe we can talk about some specific scenarios, or, how to diffuse some things.
To me was that you said the clients that you had already had a relationship, which I'm also hearing trust. It's different.
Mm-hmm.
You're not feeling that pressure of having to over communicate in a way that, essentially we are all having to do right now in the same room. We're trying to like over communicate over a screen. And so it feels different. We're not picking up on each other's nonverbal cues. And so, the medicine being the foundation of what you do, but having everything kind of branch out from that, taking a look at that component, I think will help, each individual person, whether you're a veterinarian or your front desk or you're a tech, realize that the stuff that they're comfortable in doing that is normally just kind of second nature can feel a little different. I think it starts there, and it starts with actually thinking about how is my medicine being affected? Because I think on the surface, you'd say, well, it's not. I'm still doing the same procedures, but you highlighted some really, really important pieces in that you could see is going to be part of that whole interaction with the client.
Mm-hmm. Mm-hmm.
And also the client and the patient, because like you had said, the medicine is mainly the same. So I just wanted to start there first, because it does feel like that acknowledgement then might help with, okay, now what am I bringing into this relationship, and almost kind of separating out the people that you know versus people that you don't know, right? That it's like having to kind of be prepared. So then, maybe not, when you're talking about choosing your words carefully, maybe being even more careful with saying things like putting up with, so that really, that the goal is that you guys start on the same team, right? And I think the other piece of that trust
The
component,
client and the staff. Yeah. Okay. I just wanted to clarify.
well,
Yeah.
that's good. That's good. And I think, the other piece of that is that this trust thing, that we're finding that things that we would normally trust in, and I'm talking just in general,
Mm-hmm. Mm-hmm.
all a little less trustful, because there's a clear threat of, health and security. And so we're bringing that into every interaction that we
Yep.
have. And especially a client is going to, because they're not in their comfort zone, and they're coming into you've had to change your comfort zone, and they're coming into yours, and
Mm-hmm.
they're telling you what to do.
What?
They're kind of telling you what to do in some cases.
Yeah.
And telling you
Yeah.
that, they want this to be maybe the exception of the rest of the COVID world.
Right.
And
Right.
so like maybe their threshold for going to the grocery store differently is, some of them are doing that, some of them aren't, right? Like you might also
Mm-hmm.
notice all this chaos, people are kind of picking and choosing for themselves, what they comply with. And
Right.
so, I think people are losing their threshold. And so they're trying to then, see what they can do.
Yeah. Pushing boundaries, and yeah, for sure.
You had a guy that was basically like rattling the door, right?
Yes.
And so like just that, feeling of, again, if you view it as like, this is my comfort zone, and now I've created this comfort zone to be more safe for my staff, which means keeping people out. And then all of a sudden you have somebody at the very basic first push
Boundary. Yeah.
saying, no, I'm not going to listen to you,
Yeah.
and I'm
Yeah.
going to force my way in.
Yeah.
I think that would, just even
Yeah.
hearing that, story, I felt a little
Right,
shaky.
right. Well, and that's something that I didn't experience personally. I mean, I was there in the building, but my receptionist came back and actually it did rattle her. You know, she was just like, I don't know what to do. And so she left. You know, she got out of eyesight of that person. And yeah, I mean it was strange because it did feel like his response was way exaggerated. And there's a sign right on the door he was rattling, you know, that we're not allowing people in the lobby. Please call, big bold numbers with, you know, with our phone number. And just the fact that he was so incensed, or whatever word you want to use, that he wasn't even seeing that. You know, he's just, let me in, let me in. And so yeah, I mean, I actually did forget about that, but that is a good, and it does, it kind of, at your basic level pit of your stomach, fear, like it, you know. And again, when you look at it rationally, he's not going to bust through the door, but it is one of those things where it's like your immediate reaction is fear, and oh my gosh, I don't feel safe, I don't feel comfortable. So yeah.
I think something like that is hard because if you look at prior to COVID, you have these set of rules and boundaries of, a client would never, I'm hoping you haven't experienced this, bust into the operating room while you're doing
Yeah,
surgery.
yeah, no,
We
no.
have agreed upon, standards and boundaries. And so some of these things are really being challenged right now.
Mm-hmm.
People aren't like, I think the bigger question is like, then how do you communicate that to the person and how do you kind of stand your ground on that?
Mm-hmm.
And I think
Mm-hmm.
kind of getting back to one, words matter, but then also like, so what does that person, that friendly person do? Because they are not, I'm assuming it didn't happen at end of day. And even if it happened at end of day, you still have to come back. So
Mm-hmm.
not only trying to kind of, be secure in some of those rules and boundaries, but then what do you do when the people are breaking them?
Mm-hmm.
So I think something that's very helpful is to just um, really, as a clinic, feel like this is our new rules and standards of care, and they are non-negotiable. And to kind of view them as the same as your other previous non-negotiables. And I think
Mm-hmm.
that makes the whole team feel more, um, really secure and on the same page with that.
Yep.
I
Yep.
think a lot of times having that view will automatically change the language around it. Because you would never say, sorry, you have to put up with standing outside in the waiting room while your dog is being neutered. Or
Right.
be at home and then come back
Right.
and tell you
Right.
for your dog.
Right.
Those are just, nobody has a hard time saying that. And so I think
Yeah.
we
Yeah.
have a whole clinic sit down and say, look, what are our non-negotiables because of COVID? And are these non-negotiables because they are CDC guidelines? Are they non-negotiables because they're Washington State guidelines? Or are they non-negotiables because they are, veterinary?
What we want to do.
Yes. And
Mm-hmm.
have it be, you know, um, this is what we're doing.
Yeah,
And
no, I think that's good. I do like that idea. And that's something that we haven't, I mean, I guess piecemeal, you know, we've done that because I have said to my staff, listen, if anybody has a problem with this, you let me know, I'll get on the phone, right? I'll get on the phone, explain it. If they don't like that, then they've got to find another clinic because this is how we're operating for our safety as well as theirs. And so, you know, I do think it would have been more effective to, at the beginning, kind of, you know, lay that out. These are our non-negotiables. If anyone pushes back on this, you say, I'm sorry, or you come and get, you know, someone
and
who can get on the phone and explain it.
your clinic might be more strict or not as than the other, but then that client has the choice to say, well, this clinic over there actually let me go in. Okay, fine.
Great. Yep. Great.
Just like maybe, I mean, yeah, there's going to be a standard of care that's very common through clinics, but you guys might have procedures pre-COVID that were different than other clinics, and
Right. Right.
may choose or not choose to, be with you because of that. And I think, there would be no expectation for any clinic to have sat down on day one. And we've seen this in every other, facet. Like both of us have, kids that they were going to go to school, then they weren't going to school, and then online, then not. So nobody, we don't expect that. So I think, it's really something where you can still do it today?
Yeah. Yeah,
Learn.
and that's a good point because I do, that's something I have to constantly remind myself that it doesn't have to be, oh, shoulda, coulda, that you still can say, hey, listen, let's all get together and decide, what our rules are, what our new rules of engagement are for this period in time.
Right. And I think, even if you've kind of come to a place where it has been piecemeal and it's working, I think sitting down, it's really going to also help any staff that has previously had an interaction, because it's going to feel like, okay, I feel safer now. I think one of, the first things is really to share that experience with the clinic, and not to have it be where it's like, okay, every 5 minutes, hey, this happened, hey, this happened, but to that front end person who had the doors rattled. I mean,
Mm-hmm.
having that security of letting people know what's going on, so that you're not just holding it all completely in, and that you can kind of really just process, how that, and this is the thing that can be hard. You a little bit have to remind yourself to do, but what are the feelings associated with that, right? I mean, we can guess fear, right?
Mm-hmm.
But just letting that person have a moment to say, I just experienced this, so I don't feel like it's just me.
Mm-hmm.
So
Mm-hmm.
having people that get it, um, to be able to talk to. And so maybe you end up setting a little bit of time at the end of the day to be like, how was everybody today? How was your day today?
Mm-hmm. Mm-hmm.
Then, and I always need to decide, practice what I preach on this, but one of the biggest decompressors for compassion fatigue or things like this is aerobic exercise. And it doesn't have to be like vigorous, but going for a walk, really trying to get out and do some of that movement so that you're not going from work clinic to home stuck, work clinic
Mm-hmm.
stuck. Especially because you'll start to maybe even associate the clinic with some of the, especially if you have experienced some secondary traumatic stress in that, you'll start to associate areas of work,
Mm-hmm.
in general, with those feelings. And so
Yeah.
if you don't get those feelings out or have someone to talk to about it, um, then you will, or even just areas of your home too. Like if you always go home and go to kind of the same place, and you're like feeling those but not getting them out, you're gonna start.
Mm-hmm. Mm-hmm.
Right now,
Yeah.
you have a lot of options. You can't
Right. Right. Right.
you can't.
You can't make your safe spaces toxic right now. And
Mhm.
the other thing it made me think of, I love the aerobic exercise. And again, I need to be better about practice, what I preach. But I, I mean, a way to think about it is, you know, we as humans go into that sympathetic fight or flight, even if it doesn't seem like a life threatening thing,
Mhm.
your brain and your body go there. And if you don't give your brain and your body a chance to expel that energy, right? Like think back to caveman days. If there's a saber-toothed tiger and it was going to get you, you ran, right? You had that fear, fight or flight, but then you could exhaust those hormones and those, I mean, you actually had that outlet. And now we don't have it. We have to make that outlet, and so I do
And the
that
other,
reminder that you need to do that's a way to dispel some of that stuff. Again, I still think it's good to talk through it, like you were saying, and do the mental work with it, but physical is part of that too. You got to expel that fight or flight energy.
beliefs. And the other piece of that too, that I have to practice what I preach, is nutrition. Really helpful thing too, in addition to good nutrition and exercise, is to take that debriefing, and talking to your peers a step further, and actually have intentional processing. So we talk a lot about this in the work that we're doing. And I like how a lot of times you explain it where you're like, I talked to my husband Jade about it and he's a great listener. But that, like, when you and I are talking, we're actually actively and intentionally processing. And so
Mm-hmm.
that really, helps that, the person kind of know what level of, potential trauma that they're dealing with. And that might sound like, whoa, now we're talking about trauma, but yeah, we are.
Yeah. Yeah.
But you don't know until you start to really intentionally dive into that. And I know that, we tend to use that analogy of an ailment or a wound, especially since you guys are in the medical field, where it's like you don't really know what you're dealing with until you clean that out and see.
Yep.
It might be like, hey, all you need is some, bandaging, or it might be you need a reset, or you need
Yeah.
surgery.
Right. Right. No, that's a really good analogy, and that one that we can all understand, right? How many wounds have we as veterinarians and veterinary staff dealt with where what you see on the surface gives no indication of what's going on underneath? So yeah, we need to be able to practice what we preach and do that for ourselves.
And when ignored, it's going to be worse. And it
Right.
doesn't mean that it
Right.
won't heal in some ways on its own, but why take that chance when,
Right. Well, and it's not going to heal as well, and that's another thing that we know. So great. I mean, that was very helpful. Thank you for those insights and kind of talking through that with me. And Erin and I are going to continue to try to put these little mini sessions out there. But please, if people have specific topics you want us to talk about, put it in the comments, send us a message, and of course we are. Again, with this coronavirus stuff, things are a little bit differently, and our initially this work was meant to come into clinics, and kind of deal with the problems that are going on, but we can do that via Zoom, either with a group or one-on-one. So we are, still available, to set up appointments if people want to work with us one-on-one. We'd love to work with you and keep moving forward, basically.
providing care to the caregivers and healing to the healers. Like that's what
Yep.
we want to do. And so please visit us on empathpartners.com and reach out to us also on social media on Facebook too.
Awesome. Thanks,
Great.
everyone. Stay safe.